Was it an accident or something else entirely? That's what many men wonder when they notice a wet spot on the sheets after intimacy. Some even ask, did she just lose control, or was that a real physical reaction? And no, this isn't about scenes from adult films. This is about real women in real relationships experiencing something that has puzzled partners for decades. Today, we're going to talk about what's actually happening, the phenomenon known as female ejaculation, or what many call squirting. I'm Dr. Hana Kim, a men's sexual health expert. I will help men and women understand their intimate health without myths, judgment, or shame. So, let's begin with a simple question. What exactly is squirting? Squirting is the involuntary release of fluid during stimulation of the front wall of the female genital organ, an area commonly associated with what's known as the G-spot. When that part of the body is stimulated the right way, something fascinating happens inside. To explain this, let's visualize the anatomy. Imagine the female reproductive system as a small structure tilted slightly backward. The bladder sits just behind the pubic bone, right above the front wall of the vagina. And right behind that bladder wall lies the area that reacts during stimulation, the zone often linked to squirting. Studies suggest that 10 to 40% of women experience this response. Personally, I believe the number is higher. Why? Because this isn't some rare superpower. It's a natural reflex that can develop once the body learns to release tension in that area. However, not all women find it pleasant, and that's important to understand. Some women say everyone talks about fireworks and magic, but honestly, it's just a mess, and that's okay. Pleasure looks different for everyone. Now let's break down what really happens during this kind of stimulation. When a partner uses their fingers or another form of touch to stimulate the front wall, roughly 5 to 6 centimeters inside, the pressure reaches a small area that becomes swollen and sensitive. That swelling means blood flow and nerve activity have increased. The body is responding. If the stimulation continues correctly and gently, this area can trigger an involuntary relaxation of the bladder's sphincter muscle, allowing a clear, odorless fluid to be released. It's not urine. It's a filtered plasma-like fluid expelled through the urethra. Think of it like this. The kidneys constantly filter the blood, creating a clear plasma that would normally become part of the urine. During intense stimulation, that fluid can be released before it ever turns into actual urine. Even if a woman empties her bladder before intimacy, this reaction can still occur because it's a reflexive physical response, not a sign of loss of control. However, not all fluid releases are the same, and this is where many people get confused. Some women ask, I had bedroom activity. Everything was fine. I reached orgasm, but later, when I went to the bathroom, a lot of liquid came out. Was that squirting? In most cases, no. That's not true squirting, but rather temporary weakness of the bladder muscles. If this happens after standing or sitting, it may indicate the pelvic floor has relaxed too much, something that can and should be checked by a gynecologist or urologist. True squirting occurs during or immediately at the peak of stimulation, not minutes later. Now, let's talk about how this experience differs from a clitoral orgasm. Clitoral orgasms often come with intense contractions followed by what's called a refractory period, that short time when a woman can't be touched because the sensitivity is overwhelming. With a squirting orgasm, that's different. There's relaxation instead of tight contractions, often followed by a feeling of euphoria or emotional release. The body resets, but the woman can continue if she wants. There's no pause period. So yes, these are two different physiological responses, and one doesn't replace the other. Some women experience both in one session, others only one type, all perfectly normal. It's also important to say this clearly. Squirting doesn't automatically mean extreme pleasure. For some women, it's enjoyable. For others, it's neutral. And for some, it can feel emotionally overwhelming or even uncomfortable. And that's where communication matters most. If you're the partner, remember this: gentle, attentive touch is everything. Avoid sharp nails, dry friction, or rough movement. Use lubricant if needed. The body's natural readiness and comfort are essential. When a woman isn't fully aroused and the tissue isn't hydrated, friction can lead to irritation or even post-intercourse inflammation. Respect and patience will always create better results than force or speed. Now here's the good news I promised earlier. If a woman wants to learn to experience this kind of release, it's possible. Like any reflex, it can be trained slowly, safely, and consciously. The key is creating trust, both emotional and physical. When a woman feels safe and her body is fully relaxed, that's when true reflexive reactions appear naturally. And one more important fact, the liquid released during squirting is not urine. It's usually clear, odorless, and light in texture, very similar to plasma. Scientists have analyzed this fluid and found that it originates from the perithal skin glands, which are homologous to the male prostate. In other words, men and women share similar internal structures responsible for producing fluid during sexual arousal, just expressed differently. So, in a sense, squirting is the body's way of letting go. A natural reflex that happens when both the mind and body surrender to deep relaxation. It's not something that can be forced or manufactured. It's a release that happens when there's no more tension left to hold. The pelvic muscles, which often carry stress, finally let go. And that release is what the body expresses. But there's something even more fascinating here. Something far beyond the physical reaction itself. For many women who experience this, it's described as an emotional unburdening, a moment where their body and emotions align in pure freedom. Afterward, they often say they feel lighter, calmer, as if years of invisible tension have suddenly melted away. It's like a quiet exhale from deep inside, not just pleasure, but peace. And for men, understanding this goes far beyond any technique or physical skill. It's about empathy, presence, and patience, truly listening to what her body is trying to communicate. Because the goal isn't to make it happen or to chase a reaction. It's to understand the language of trust and connection that her body speaks. Every person's body tells its own story. And the more we listen, the more we learn that pleasure isn't just about touch, but about emotional safety and release. So to summarize, squirting is the involuntary release of clear fluid from the bladder area during stimulation of the front vaginal wall. It's not urine. It's filtered plasma free of odor and color. Not every woman experiences it, and not every woman enjoys it, and that's perfectly normal. Communication, patience, and comfort are essential. And now, let me end with something I've learned after decades of listening to people talk about their most intimate experiences. Intimacy isn't about performance. It's about connection. Real confidence doesn't come from what you do, but from how deeply you listen to your partner and to yourself. When we understand our bodies without shame, we not only improve our relationships, we reclaim a part of ourselves that was always meant to be free. So be kind, be curious, and never stop learning. Because the most powerful intimacy begins with knowledge and grows with respect, with warmth. Dr. Hana Kim, men's sexual health expert.